my name is Dr. Amy Luedemann-Lazar from Kidstown Dental, and this video is information about the function of a tongue and the benefits of releasing a tongue tie very young in life. I actually give this class to parents of infants, and what we see and our concerns for waiting and not treating early. So this first little picture represents a lot of the functions of the tongue. If I were to make a door here and sort of open my face so that you could see a cross section, what this represents is the tongue as it's about to swallow against the palate, the hard palate and the roof of the mouth. This 500 grams of force is because when the tongue swallows, it exerts 500 grams of force against the roof of the mouth. For reference, it takes 1.7 grams of force to move a tooth. So 500 grams of force is a lot of force. We swallow 1,500 to 2,500 times a day. So what happens with all that force? What's the function there? One thing that the tongue is supposed to do with that force is to shape the roof of the mouth. So the roof of the mouth and the tongue should be a hand and key fit, hand and glove fit. And so what this red line represents is when babies are born who have a tongue tie, one of the things you'll notice right away if you put your finger into the roof of their mouth is that the roof of the mouth is collapsed, and it's collapsed up into the airway spaces. So they'll have what we call a high palate or a narrow palate already because the tongue has been restricted and not able to create that shape, so you get a bit of a collapse. The other thing that 500 grams of force is meant to do is drive the growth and development of your face, jaws, and airways. So when the tongue is functioning and not restricted, your facial growth is this way and this way. So you get really beautiful cheekbones, a really nice jawline, and a nice spacious airway behind all of that. With the nice facial development, you get a nice broad face, really coming forward and aesthetic, and less likely to see the pooling under the eyes or the bags under the eyes, because all that is venous pooling, where you get the dark circles. We call it allergic shiners, but it's really an indication of lack of growth and development this way, because everybody has venous pooling here, but it becomes really prominent when the face is flat and the growth and development isn't in the direction it needs to be. The other thing that 500 grams of force is meant to do is to clear, it flushes or pumps the sinuses. So it releases your maxillary sinuses, your nasal sinuses, your ocular sinuses, and the most posterior part of the swallow, it activates a muscle in your soft palate called tensor veli palatini, which tugs on your eustachian tubes and clears those eustachian tubes. Really important part of function of the tongue. So shape the palate, which shapes the jaws, drive growth and development of the face, jaws, and airways, and pump and clear the sinuses in the head and neck area. So benefits from doing this early, of course, improve tongue function. So all the things we talk about are going to improve. And waiting, a concern is poor tongue function, which creates lots of problems in the things that we talked about. You'll have improved bottle and breastfeeding. So the ability to transfer milk efficiently and effectively, to help mom to be stimulated to produce the right amount of milk, to not leak milk or take a lot of air in because of the tongue not functioning properly or not having a good seal. All that's diminished when you have improved tongue function. So decrease nasal, maxillary, ocular, and ear congestion. What I see in kids when I see them at a year, even sometimes the young babies, I call them junkie breathers, so they're kind of this sort of Darth Vader-y sound sometimes, or sometimes a little bit less noticeable. But the junkie breathing, congestion, and maybe by a year or two they've already had ear tubes or lots of problems with their ear. And it's because the other thing that they'll have is when their brother or sister or someone gets sick and they get sick, they tend to hold that congestion a lot longer, be sick a lot longer, take a lot longer to clear it. So that's just things that they're kind of plagued with early in life. And then solid food introduction happens around 6 months. So when you introduce solid foods to kids that are tongue-tied, you can see, I had a friend say, oh, my daughter's a self-professed vegetarian. But actually what happens is your tongue, and when it's fully functioning and not tied, is supposed to move the food around to help you chew it back and forth, create a little wet ball called a bolus, and shoot it down the hatch. When it's restricted, you're going to have a hard time doing that. And so if you look at a person right before they swallow with a tongue tie, they'll have something called scatter. So they're kind of gagging on the foods. And so when I ask a family about their 2-year-old, the eating, because I'm checking about their risk for cavities and other things. They say, oh, Sarah's a really picky eater. Oh, well, tell me more about that. What they usually tell me is that Sarah is only eating processed and soft foods. She's refusing meats and vegetables and even some fruits, or sometimes she'll love certain things, but basically she'll refuse a lot of things, and that's Sarah's natural inclination to protect her airway. That's very normal. But the problem is, the two things that make you have a gorgeous face and beautiful, healthy airway is the tongue function and chewing. So we really need to chew from early in life to work the muscles of mastication and to grow this beautiful face, jaws, and airways. So lots of things happen when they are choosing soft foods. Smaller face, jaws, and airway, because they have all this stuff going on. They're more at risk for cavities because those soft processed foods turn to sugar faster, they stick to the teeth longer, they're more likely to get cavities, and they're going to have they're not going to be as healthy systemically because those foods do not have the vitamins and nutrients that they need. So it really sets up lots of problems when they're just eating the soft. I'm actually a big fan of baby-led weaning and getting kids to chew foods from early in life safely. So again, the things that we see are picky eaters, soft diet, gags easily, brushing teeth, or eating certain things when we leave it untreated. What we also see is, what we just talked about a lot, is improved development of face, jaws, and airways. Speech, so around 18 months to 2.5 years, kids should be talking, getting more words, putting words together. What we see is either no talking or much delayed, much later than their peers, or they're talking and no one can understand what they're saying, and so they're having temper tantrums all the time because that age really wants to communicate. Or maybe you can understand a lot of them, but someone else would not be able to. That's very frustrating for a toddler. So we see temper tantrums and issues with speech. When they have articulation issues, which are mainly driven by a restriction, like a tongue tie, and we treat it, those things change the same day. When they have other issues, what we call brain to tongue issues, like apraxia, for example, that's something you're still going to need to work with a professional, like a speech language pathologist, to work through those things. But articulation issues from a tongue tie changes the same day every time, which is wonderful, but it's better if they don't have that in the first place. And lastly, I have sleep, which is really, really important to mention. In 2016, you can look at Stanford's website. There's a guy there named Dr. Christian Guilleminault. He coined the term obstructive sleep apnea. He's one of the fathers in sleep medicine. He's won numerous awards for his research in sleep medicine. And research in 2016 showed that a tongue tie is a marker for sleep apnea. So I also like to mention that in Australia, it's illegal to give ADD and ADHD medicine to children without performing a sleep study because it looks identical. Those behaviors, lack of focus, hyperactivity, those kinds of issues are often seen in children who have problems with sleep disordered breathing, sleep apnea. And I just want to unwrap that package a little bit for you. When you have a tongue tie, so everybody is born nasal obligate breathers. When you have a tongue tie, they often switch to being mouth breathers because their tongue is restricted to the floor of their mouth. When you breathe through your nose, you warm the air, humidify the air, clean the air, and release a gas called nitric oxide. And there are receptors in your gut, in your lungs, and in your bones. And that is a parasympathetic gas which activates your rest and digest. It's really, really important. When you breathe through, so that looks like this. When you breathe through your mouth, that's sympathetic. So you're activating the fight, flight, or freeze nervous system. It's going to be a little bit more ramped up, have a little bit more cortisol, all those things that you don't want all the time floating around in your body, especially for a kid. But when you mouth breathe, your tonsils and adenoids are asked to do something that they're not meant to do full time, which is get the air ready for the lungs. They're never going to do as good a job as your nose is. So when you're mouth breathing, your tonsils and adenoids are going to enlarge and take up more airway space. Your tongue is resting down and back in your airway, which takes up airway space. And you're going to have more asthma and allergy symptoms, one, because you're not pumping and clearing all these sinuses, and so that's going to be a chronic congestion and possibly postnasal drip, and two, because you're taking dirtier air into your lungs. So all of those things combined, inflammation, obstructions of tonsils and adenoids, obstruction of tongue tie, are this snowball effect. And when you go to the ENT or the pediatrician and they say, yeah, you've got sleep problems, or your kid has sleep problems, let's take adenoids and tonsils out, you're not dealing with the etiology of why that happened in the first place, and there's a 60% relapse, and the tongue is still back in the airway. And you probably all know people who had adenoids out and they regrew. This is why. Sometimes you take them out again, they grow polyps. You've got to get rid of that. I mean, it's just so critical. The other thing about mouth breathing, aside from all this, is literally in a growing child, that heavy tongue organ resting down in the jaw instead of pushing up and guiding growth and development changes the trajectory of growth of your face, jaws, and airways. We see very common, I was on a recent Facebook post, and it was very emotional for moms. Someone was asking, is it normal for my child to be sleeping with their mouth open? Someone else was saying no, and for real reasons why it's not okay. But then people were like, well, I mouth breathe and I'm totally fine. So just because something is common, and it's very common nowadays for people to mouth breathe and kids to mouth breathe, does not mean it's our biological norm and it's the healthiest thing. We should be breathing through our nose when we sleep and when we're awake. That's the biological norm. That's healthy for us for all of these reasons. So, you're a little baby here. These are the main things I like to share with families. It's really great if there's a tongue tie diagnosed to treat it as young as possible. Doesn't mean you don't need to do some pre-work sometimes with a myofunctional therapist, an IBCLC. It's great to see a qualified chiropractor with craniosacral in their hip pocket, so to speak, to get baby ready, so that you don't just jump in when you know there's a tongue tie and do the surgery, but you get baby and mommy ready. And we have other posts and blogs about that. And then these are the reasons why we do it. And the last thing I'll say about it is just that I have people tell me sometimes that the pediatrician said, yeah, there's a tongue tie, or the ENT said, yeah, there's a tongue tie, or even the SLP said, yeah, there's a tongue tie, but we don't think it's going to make a big difference for treating, or we don't think, you should treat it now or you should wait. I think that's completely wrong. If we know that it can cause all of these things, why on earth would you wait until your child has sleep apnea? Why would you wait until they are having speech problems and you're paying money for speech? Why would you wait until they've already picked a soft processed diet and get used to those somewhat addictive foods? Why would you do that? When you know something's wrong and a tongue tie is not going to stretch or change, you should treat it as early as you can and do it safely. So I hope this helps, and the benefits of doing it early, a little bit about the function and what can happen when you wait. Don't worry about all this. This is just a different video I do later for parents the day of surgery and what to expect. Thank you very much for watching. Please feel free to send questions, or if you'd like to call our office, the number is 281-394-7040 if you need an assessment or consultation or have questions. Thank you.